Good evening. How are you? My name is Nicole Crooks. I'd like to welcome you and all of the panelists to our Poverty Solutions Community Health Workers panel. Thank you so much for being here. I just wanted to take a moment to introduce myself briefly. My name is Nicole Crooks, and I am the Community Engagement Coordinator here with Catalyst Miami. And I'm also a resident of Overtown, the community in which I live and work, and just humbly, the community team captain of the Girl Track Overtown neighborhood team. And so I'm really also very grateful to serve with the community champions. So I just want to give a quick shout out to them. All right, so one of the things that I'm trying to do is I want to make sure that we acknowledge the land that we're standing on. And we acknowledge that this ground is stolen and that people that lived here before us were decimated just for us to be able to be here. And so we just want to take a moment to honor the sacrifices and seek forgiveness and atone for the harm that has been done to them and their land. And before we start, we'd also like to just take a moment to honor and celebrate all of our ancestors, our elders, and our children. And just in this moment, as we set the intention for how this panel will go, we just definitely want to understand that we're here to honor and celebrate the community health workers for all that they do for our communities, just in terms of preserving, loving on, and celebrating and protecting all of those within the community. So thank you so much for being here. And now I'd like to introduce our panel. First and foremost, I'd like to introduce Amelia Solano, who is the District Executive Director of Community Health Strategies for the YMCA of South Florida. She oversees operations for the Village of Alapata, the YMCA Family Center, which is located here in Miami, and the LA Lee YMCA Mizell Community Center in Fort Lauderdale. She has more than 20 years of experience with a background in community organizing and social justice, working with communities experiencing racial, ethnic, and health disparities and economic inequalities nationally and internationally. Through her exceptional community outreach and engagement leadership, she has developed partnerships between the Y and multiple community organizations to secure the delivery of services for youth development, healthy living, and social responsibility here in South Florida. We also have here Carmen Garcia, who is a senior community health worker at Make the Road, New York. She joined Make the Road New York as a community health worker in 2015 after completing the organization's training program. She started helping families with children under the age of 6 prevent and fight tooth decay through educational home visits. She currently leads 2 asthma management projects where she conducts home visits to assess and minimize exposure to asthma triggers. I just thank both of you so much for being here. We're honored. And just to kind of describe a little bit of the way that this process will go is that we will hear from our panelists, and then we will have about 15 minutes reserved for questions and answers at the end. So anything that you would like to ask, please add it to the chat and we will address it. All right. Thank you. All right. So Carmen, I would love to start with you. Can you tell me a little bit about, I'm not going to start with you, Carmen, okay?
Okay.
Amelia, I'm going to go to you. Listen, giving you a little breathing room. But can you tell us how your program with the community health workers, like how does it benefit the community? And give us a little bit of insight as to exactly what it is and what it looks like.
Sure, sure. Thank you, Nicole, first of all, for grounding us. And I also want to commend Catalyst Miami for this amazing summit. When you grounded us and mentioned our CHWs, community health workers, I got a little emotional. And really that's because it is the work of our community health workers that really addresses all of these issues one by one, person by person. Something that we have learned over the past, over 10 years that we've done this work is that your zip code, unfortunately, will determine how long you'll live and the quality of your life more than your DNA. And that is the reality of here in Miami and across the United States, unfortunately. Specific to our community in Miami, there's a gap of 15 years between Overtown and Brickell Key in terms of the life expectancy for someone, a baby born in those two communities. And that's terrible. That's absolutely unacceptable. The work at the YMCA of South Florida, we have been doing this work throughout South Florida for the past, we've been in the community for over 100 years. So our organization is very much a staple between Broward County, Miami-Dade, and Monroe. Anything from, childcare, youth development, drowning prevention, health and wellness programs. But what really sets our association apart is our community health worker model and the programs that we provide. How does this work? We focus on, there's two things that really kind of help us move this along, and we learned very early on. Number one, we cannot expect for the community to come to us. We cannot expect people to come to our doors as much as we would like them to. That's not going to be the way that we can really make an impact. So we learned that we had to go out into the community, we had to find the way to get to them. The other thing that we learned was that we needed to listen to the community. And through our experience, our first community health worker, may she rest in peace, Miss Phyllis Wilson, she started everything by literally going under the tree in the community. Our LA Lee YMCA Mizell Community Center is located in the Fort Lauderdale community of Sistrunk, historically Black community. And she would go under the tree where the guys were playing dominoes and she would talk to them, about their health, about their life, about their quality of life. And that's really how we got started. It was because of her. Over time, we learned more and more that the Miss Phyllis's, the Miss Ruby's, Miss Marlene's, Senora Evelyn, these are men and women who live in the communities. They experience all of the challenges. They live these challenges every single day, whether it be dealing with diabetes, blood pressure, not being able to pay the rent, especially now, COVID, dealing with trying to find food, and so many other issues. These are truly the leaders, and we learn that we have to listen to them. And by listening to them, these are the people that they know everybody on the block. They know all the, the people who don't go to church. They know whose kids are not behaving. They know these things. And in order to do anything and make any impact, we have to listen to them. They have the answers. And little by little, we've developed a way to listen to them. Passion is not something you can learn. Passion is something you have. Everything else you can learn. You can learn about diabetes. You can learn about taking blood pressure. You can learn about all of these other things. But these are people who are passionate about their community, about their health, about the bad things that are happening that shouldn't be happening. And so we employ them, and most of our team were volunteers. Many of them volunteered. They came out, they volunteered, spent their time. And then we said, you know what? We want you to work for us because you're amazing. And over time, we've been able to develop the training program through many of our programs, education on diabetes, as I mentioned, blood pressure, health navigation, dealing with depression, I mean, all kinds of things, along with other areas that impact their health, including financial literacy, you know, dealing with mental health challenges. All of these areas, we've been able to train them, give them the tools, but it's really about the way that they identify and tell us what do we need to do next. And through over these time, we've been able to really look at that as a way to make a very deep impact. When you, our previous speaker at the previous session talked about, you know, the fact that health disparities is about racism. It isn't about race, you know. This is truly, you know, this is how you dismantle it, one by one, person by person, providing the tools to break open this beast of a health system and any other institution, small daily challenges to overcome everything. And we don't just address one issue, we look at multiple issues, because it isn't just one. You know, we can't just talk about diabetes. We can't just talk about blood pressure or sugar, you know, azúcar. You can't just do that. It's all together. We have to look at every piece of the puzzle. And so that's what we've been able to do. And some examples, recently, we look at health equity. We talk about COVID, you know, Dr. Holder did an amazing discussion, you know, looking at COVID. So we've been doing some work around getting vaccines to the communities who need it, you know. They can't get the appointments, you know, they're not getting the appointments. So it's our CHWs, our community health workers, talking to them, trying to, you know, share with them. Some of them are fearful, but it's coming from someone they know, they look like, they speak the same language culturally and verbally. That's never going to be the same as a physician with a lab, you know, a white coat, unfortunately. It has to come from someone that's really, you know, identify with the person. And so those are some of the things that we've done both in Broward County and Miami, particularly in the Allapattah community and throughout the Sistrunk area as well. And in order to expand this, we're always looking at who are those in the community that can tell us, okay, where do we need to go? What meeting do we need to go to? What church meeting do we need to, you know, attend? Is this the right way to approach it? We couldn't do anything without them telling us, you know what, you need to change it. You need to do it this way. Let's talk to them this way. Let's make the flyers say it this way, you know, addressing these things literally. And then by doing that, you can actually empower the community person by person. Our health system is set up in a way that we have to adapt to it. Health equity is basically looking at it and saying, no, this health system needs to adapt to the person. And that's what the community health worker model that we've been able to work through, and really any model that we look at is, you know, how can the community really take control of these different institutions and break them apart, and really give information that previously is really, you know, hidden from them because it's such a cumbersome institution.
Mm-hmm.
So
let me ask you this. What have been some of your challenges with this model, especially in terms of like expanding?
I would say a couple major challenges has been one, you know, in the clinical field, you might hear the term the clinic to community gap, right? So a lot of times, you know, we see someone leave, you know, their doctor, you know, or whoever in a clinical setting, a list of things that they're supposed to do, but then they get home and they still really don't understand what they're supposed to do. Or do they have the ability to do those things, right? So if I can't pay my rent or have food in my fridge, how am I going to take care of my diabetes? You know? So one of the biggest challenges is finding a way to bridge the gap between us as nonprofits, as grassroots CHW teams, and connect more with health industry, whether it be clinics, physicians, hospitals. They need to employ us. They need to fund us because that really is going to be, not only is it going to, obviously it's going to impact health equity overall, but it's also from an economic standpoint, it's going to hit their bottom line, right? They're going to be able to save money. Health insurance companies, they're going to be able to save money if we can save our people, right? So that's one of the biggest challenges, is just making that connection, and then also, funding these programs. We really need to see these everywhere, every hospital, every health insurance company. I mean, every institution in terms of health should be employing CHW and organizations that do this type of work already. So,
thank you so much. And then can you tell me, Carmen, how this compares to what you do there at Make the Roads Community Health Workers Project?
Yes. Thank you, Nicole. Thank you so much for inviting me today. And I'm very excited to share all the wonderful work we're doing here in New York. As you say, I'm a senior community health worker from Make the Road New York. And a lot of the work we do, it is like Emilia was telling us. We are a community-based organization, and we we address many issues in the communities: immigration, access to food, access to healthcare, workers' rights, tenants' rights, and inside the health piece of the work of the organization, we work with community health workers. And I work with this asthma program under district with health in hospitals. So we partner with two hospitals, and we also partner with other health insurance, main like Metro Plus and Health First. And so we are able to do the work that the CHWs, the community health workers, do. There is other programs also that work with other partners, other hospitals in New York City. But I could talk a little bit about the program, the asthma program that I do.
That would be awesome. Yeah, especially here, because in the communities in South Florida, especially in Miami, our asthma rates are so high in the inner city community. So we would love to hear from about it.
So the funding that we have for the program that I work, and I also lead, there is other 4 CHWs that work in this program. We used to conduct home visits. Since we partner with these with the hospitals in New York City, they provide us with the referrals, whether it's like direct referrals from the physicians or pulmonologists, or also sometimes they provide lists of admissions at the hospital. So we conduct the outreach, and we talk to the families. They are from, I am lucky because I work in a hospital in my neighborhood, and I know the community. I've been living here for over 20 years in the same neighborhood. I know everything around here. I know all the needs from our community. And so when we do the outreach, we schedule a home visit, and during the home visit, we provide education about the asthma, and mostly about asthma medications. There's so different types of medication. We educate the patients, and we also encourage them to make these little changes that they're going to make a big difference in their asthma. We also conduct a house environment assessment. There is here in Elmhurst and in the whole New York City area, there is a lot of issues with pests like roaches, mice, and mold. And these can trigger their asthma. So if we find issues like that, we help them referring to pest management services, or helping with, for example, also inside the organization, there is a committee for tenants' rights. So we refer them to our organizers and help them if they have issues with their housing situation. When we also like with COVID, we start doing all this work completely remotely. Because we stopped doing home visits. And at the beginning, it was very challenging because, you know, a lot of people, it's not like this interaction that we have like face to face, right? But we did great because we start using sometimes Zoom or Skype. And a lot of people don't have access to technology, or they don't know how to like do it. But, you know, we've been managing, and also it was very on March, April, when it was, you know, the pandemic. It was really bad here in Elmhurst, Jackson Heights. It was very helpful for the patients, because we were calling them, the asthmatic patients, the COPD patients, we were calling them to make sure they have all they need for them to avoid going to the emergency room, because at that time it was very chaotic. So in that sense, we helped them a lot. They were like, sometimes people like, they didn't even need anything, but they were very glad that someone called them to check on them. A lot of the times, they families since COVID, it hit them very hard, especially like food access. They didn't have access to food. So we refer them to the food pantry. We have a food pantry here in Make the Road, in the office here in Queens and in Brooklyn. And in the other sites, we refer them to any other food pantry. We help them with medical bills, referring to our coworkers to help them. Like, they receive like many medical bills, like helping them to apply for emergency Medicaid in case they need to use it. Like, at least they have it. Connecting them to a primary care. So it was a lot of work, but it was great that we were able to help all the patients. Yeah, and like I say, there was a lot of need at the moment about food access, and also like the people were not paying the rent because because they needed to or either they were like saving the little money they have, but a lot of people were already like very like worried, like, what am I gonna do? So telling them that they stopped the evictions, so it was very helpful for them, like, to know that they was on hold, but the same way they were worried, like, what happened in the next following months. So yeah, it was very difficult time, and it still is.
It sounds like you are a lifeline to the community, and so that can never be taken for granted. Almost like, as you're speaking, one of the things I think about a lot is not necessarily the experience that I had growing up, but it is an experience that I hear a lot of the elders here in Overtown talking about, as well as the experience my mother had growing up in Macon. But it was that village, and it was the support, and it was that trust building, and knowing that there's somebody to go to. Because even as you're talking, I'm curious. One of the things that I definitely want to know is about the trust element, right? Because inviting someone into your home is the most sacred and vulnerable thing that you can ever do, especially in a low-income area, right? Especially. So can you talk a little bit about your experiences with that and what you feel is the magic sauce for you?
Yeah. Right? For me, what it works is that we are connected to these places that they go already to take care of their health. So for me, that's key, because we are not calling out of. There is a lot of people that are like fearing and say, like, who is this person calling me, right? And sometimes they don't want to give their fear that we're calling from somewhere else. But when we say we're calling from your provider and this is a follow-up for your asthma, and they're like, immediately they say, oh, okay, yes, you could come. Yeah. It is hard, but I would say that's the magic part, like that we are already like engaged with their providers, and also like we speak the same language sometimes, but you know, like not specifically, because we also work with a lot of people from Bengali here in Elmhurst, and yeah. So, but yeah, I would say that's the part that people trust us, because they know we are from the same neighborhood. We are people like them. Yeah.
And so tell me a little bit about your journey into becoming a community health worker.
Yeah.
What was your experience?
Yeah. So when I recently came to this country, I have my kid. He was 5 years old, and then I got pregnant with my second child, and I used to go to New York City, to Manhattan, to my appointments, and it was difficult because I didn't speak English very well. So I feel like I couldn't like advocate for myself and for my baby, and also for my kid. I couldn't like speak. I didn't know that it was right for me at the time that I could ask for translation. I didn't know that. I thought it was just something that they could do, but didn't know that it was right. So it was very difficult, and I feel sometimes like I couldn't do anything, and yeah. So later, when I start studying English, and I used to like help my father-in-law and going with him to the appointments, and with my husband, like getting on the phone. So that really like made me feel like I could do a change for them. And later I have the opportunity to take the course in Make the Road New York. We have a training for community health workers, where at the time it was like 4 months of training and then an internship. So I took the training, and it was life-changing for me. Like it was great. And then I was able to like get hired by Make the Road also at the same time. So it was great. Yeah, and I'm very happy to work for this organization that is making like these big changes for a lot of families here.
Love it.
Yeah.
Thank you so much, Carmen. And so Emilia, in the beginning you referenced Miss Phyllis. And like one of the things that I feel is so necessary is always to give honor to those who came before and who opened the way for us, right? So can you tell us a little of Miss Phyllis's story as a community health worker and some of the things that she's done in the sister community?
Correct. And I just want to start by saying, you know, a lot of what Carmen said really is the heart of a community health worker. You know, having health issues is scary. And then not knowing how to navigate the racist system, all of the systems that exist, that's even scarier. And when she mentioned, you know, dealing as an advocate, she didn't know how to advocate for herself, right? You know, that's what is the issue. That's what we're dealing with. That's what we're up against. So having someone like, you know, Carmen or Miss Phyllis, you know, someone who truly just cares about, they know how it feels, you know, to have that struggle. I know how it feels to have that struggle. I want to help somebody because they shouldn't have to have that struggle. And that's really what it was, you know, about Miss Phyllis. You know, she would go the extra mile to go, like I said earlier, go under the tree where the guys are playing dominoes, you know, go to you know, someone mentioned to her, well, I can't get to my doctor's. I have to take this bus. I have to take that bus, and I have to take this bus, and I got to wait under the rain. And by the way, I'm 75. You know, Miss Phyllis said, you know what? Let me take the bus with you and see how it goes. Let's do it together. that, you know, that's the kind of thing that a community health worker will do because they care, but they also, that's how you're going to break that system, you know? And those are the types of things that someone like her, you know, and Carmen and any CHW, that's what they're doing, is they're going that extra mile, and that's power. Those little pieces are power. If I help you navigate the health system, if I help you understand, and the other thing I want to bring up is Carmen mentioned not just health. We talked about immigration. You know, there's financial literacy. There's, you know, all of those things are intermingled. And that's what it is. You know, we had one of our staff, she was so empowered. She lived here for so long as a CHW. She lived here for so long. She was empowered. She was a participant of our program, dealing with many challenges, health issues. She became so empowered that she then pursued her citizenship. But that wasn't something that had come up prior, you know, and that's just a feeling of empowerment. Like, I can do this. You're showing me the way, and I can do this. And that's what this CHW is all about. And that is what's going to change any of these barriers, is I'm getting that knowledge, I'm learning, I'm feeling more confident, okay? I'm learning that the system is not something that's my fault, because that's the other problem, right? You know, we're being told that in our communities of color, it's their fault. It's our fault that we have diabetes. It's our fault that our community is poor and doesn't look nice, but it isn't, right? So, but if I don't have those tools to maneuver these systems, how can I beat them? How can I break those chains? And that's what this model does. It really helps to break those little chains and eventually overcome this.
Right. And so I'm really curious, and definitely if anybody in the audience has questions, please put your questions in, and we will be able to ask our panelists. One of the things that I am very curious about is, like, when we talk about the disparities in healthcare and knowing that the community health workers a lot of times are located within these systems, right? How much pushback are you really able to give and to help your patients or community members advocate for themselves without jeopardizing yourselves? Or is that something that doesn't necessarily come up? But it's something that's very interesting to me, because within the healthcare system, I know that there are different dynamics, right? And so I guess I'll ask first, Amelia, I'll ask you that question just to kind of get your thoughts on that. And then Carmen, I'd love for you to expand on it.
So we're looking at, you know, generations, you know, of mistrust for good reason, right? We're looking at generations, and when I say mistrust, we're talking about through the health system, through the policies within a city, in a community, you know, building highways in the middle of cemeteries in the cis-trunk community, you know, building a dump for you know, a waste dump in the middle of a community and putting an elementary school on top of it in the cis-trunk community. You know, I mean, there's so many generations of terrible treatment and biases that have been established and policies that have been created. So then you have a person, you know, Miss Mary, you know, how am I going to beat all of this? You know, that's such a cumbersome, big thing to consider. But I think that by again, you know, the morsels of empowerment, the little nuggets, you know, we call sometimes in the why, we say, you know, you're going to give a nugget, you know, that's a little something that's going to give you the next time you're going to have even more, right? So we've seen where, you know, participants in our programs and just community members, you know, make serious changes just in their own life, you know, everything from, and just because of that one CHW has given them feedback, given them motivation, talk to them, give them options, give them tools and resources. I'm just that little bird that's going to keep telling you, you can do it, you know? And then that person has been able to change everything from their health. You know, we have someone, a gentleman, one of our team members, one of our staff, Shamil, she was working with a gentleman. His diabetes, his numbers went down, his blood pressure went down. He was homeless and he was able to eventually get work. Little by slowly, he was eventually able to become part of a program to get trained, and now was offered a full-time job, and he was able to purchase his own car. But this was a period of months, I mean, and can even be years, because remember, this took generations to get to him to where he was, right? To disempower that one person with generations. And now he's little by slowly building himself up. And that's just one person. So, I mean, it is something that we have seen the results of, and it can happen. But it's something that is such a large institution. We really need more support. We need more support and you know, and understanding when we talk about poverty, right? That is the basis of poverty, right? It's disempowerment. It's taking away anything you could possibly have to become a productive person, right? A productive person in our country. And I'm going to do this, and it's not by mistake. It's done on purpose.
Yes, right. By design. Thank you for that. And I see in the chat, thank you, Myra. And one of the questions is, how can community health workers inform how the medical field should treat their patients? This model really incorporates the social determinants of health, which doctors don't always acknowledge.
Yeah, I would say we have like champions doctors also, like in the same way that there is some doctors that maybe they're not acknowledging that there is a lot of needs in our community. But yeah, we have champions doctors that they're always like telling us, you are our eyes, like you are the ones who are in the homes, in their neighbors. You know what food are there available for them? Do you know they're like what is that their needs? So I would say like we need more of these champion doctors, like more people that understand that there is a lot of needs in our community. And also like in terms of education, for example, like we could provide all the education, reinforcement education. They already like explain what medications is this for and how to use it, but we reinforce them at home when they're relaxed, when they have time. Besides that, it's really like what happened in their home. Like, for example, like if they're taking all the medication, then they came for asthma, but they have mice, they have roaches, they have all this mold, is not going to change their situation. And informing, like getting this feedback to their doctors, they could understand. They could say, oh, okay, this is the piece that I was missing. And telling them, like, listen, this mother cannot give their medication every day because she's a single mother. There's nobody that help them. You know, they could like work around this issue and try to like get a sense like what can be done. Like maybe the medication cannot be given in the morning, but maybe it could be given in the school, or it could be given only at nighttime. And yeah, and resolving these issues for like roaches and mice and also like medication. Like there are sometimes like doctors think that the patients are taking the medication. They send the refill, right? There is a lot of issues with insurance. They don't cover the medication, or they have to pay these high co-payments they cannot afford. So if a doctor think, okay, it's because they didn't want to take it, it's not like that, right? And we report back to them, and that's how I think like we can work together, and CHWs should be incorporated in the care team, because we can work all together and to better their health. Yeah.
Yeah. And if I may, Nicole, I think that Carmen really hit the nail, you know, really right on target. You know, when a doctor gives a prescription, it shouldn't just say you have to eat this and take this, you know, and do exercise or whatever. Like there's way more to the story, you know, than just that. You know, it really is about, you know, do they have food? Can they pay their rent? You know, do they have to choose between paying for their diabetes medicine or eating? Do they have to cut it in half? I mean, there's so many other things. And the only way they're going to have that ability to connect those dots is with someone who's trusted from the community, someone who identifies with that person, a CHW who can really get into that piece that's really going to affect their health overall, right?
Absolutely. Thank you. And so let me ask you this. What do you think the various sector leaders do currently in terms of supporting and creating to expand existing community health worker programs in Miami? I hear you talking about the one at the Y. Are you alone in the Miami area, or does that exist? Do you know that if that exists widespread? Because I haven't necessarily heard a lot of talk about community health workers here in Miami.
Yeah, I would say we're pretty alone. Unfortunately, there was a mention in previous that the state of Florida just set up, you know, certification to kind of establish it as a profession, its own, you know, viable kind of profession. So, you know, that's kind of been something in the recent couple years, but it really is something that we've done. And there is not a lot of other organizations within South Florida doing a lot. There's here and there definitely are. But I think the problem is, you know, it isn't seen, the value of it isn't seen as it should be. When we talk about, and again, when you're looking at health institutions or any institution, you have to talk about money, right?
Yep.
You have to talk about money. So helping the institutions realize, like, this is going to help me save money. You know, this is going to help me save money at the end of the day. I need to invest in this. You know, I need to spend the money in the right place. You know, you're going to spend less at the end of the day, right? So it is something that's definitely underfunded and needs to be seen as what it is, you know, the impact that it has. So
Absolutely. I just want to take this time to just thank both of you so much for being here with us and for taking the time to just really pour into us. I'm going to try to do, let's try to do one more question. We'll try to do two, but we're gonna go ahead and move through it because we have a special treat for everyone at the end. It helped to start our conversation off as a panel, and we're gonna close it out with as a group. And so Ronald asks, how can we implement holistic health initiatives in achieving health equity? Great. Carmen, do you want to look at that?
I think, like I said, like integrating community health worker programs like this one, like the Asthma Program, and like other programs in our organization, programs that treat the person like a whole, like Emilia say, like not listening only what is the issue with their diabetes, high blood pressure, right? Do they really have like the money for like buying healthy food? Do they have access to places where can they buy healthy food in their neighborhood? Do they have healthcare? A lot of people do not go and do. In New York City, there is other options for people that do not have insurance. They could access to the clinics, the hospitals in the city, and they could receive financial assistance. Also, there's another program, NYC Care, but a lot of people, they don't know about this. So our work as advocates, community health workers and promoters and advocates is tell them like there is a place they could go and that they could afford. And treating all this need for the people and taking care of all these housing issues that we have. And for asthma, and their asthma is not, people's asthma is not gonna get better if all these issues and in these neighborhoods and they keep on being there, right? So like advocating to like elected officials, and telling them that this is something that needs to change. So our organization has a lot of, they win a lot of like campaigns, and we have to keep doing the work. Yeah.
Thank you so much for that. Now, one of the questions that we have from Mr. Peary is, and this is an Amelia question, I believe, for Florida, is do you know if government or private health plans will reimburse providers for community health workers?
Currently, we don't have, anything that's kind of established right now. That is something that has been, brought up, and there's definitely some groups that have been trying to address that. Because again, at the end of the day, it is proven that there is a big effect in the return, in terms of doing it in this way. But it is something that we really need to see. And actually, just to add to what Carmen mentioned, so, there has to be two layers. There has to be a layer at the individual level, at the institutional level, but then also policy, when we look at even just at a local level, cities, communities in particular, using a model such as community health workers to address all of these different issues. So there has to be many different ways that we address it. So
Thank you for that.
And I could talk a little bit. I'm not like, this is not my field, but for example, we have fundings like sometimes like from foundations that pay for these programs, especially because there is a lot of people, uninsured people. So they could like cover this part, but also community-based organizations are not Medicaid billers. So that is kind of like the issue, right? Like, cannot like get the reimbursement from the Medicaid.
Right.
But the goal, like in one of the asthma projects that we're working, is to work directly with the MCOs, the major care organization managers. And so we could get reimbursement for the services that we provide, because definitely like we make save the healthcare health insurance a lot of money. Yeah. Mm-hmm. With the prevention, with all the education we provide, and we prevent them for being in the emergency room, admitted in the hospital, and everything. Yeah.
And cared for. I thank you so much, because when you talk about community health workers, one of the things that I know is that those of us that pour the most into community and love on community the way that you do, a lot of times it is at the expense of ourselves or our families. And so one of the things that is so important is in the process of loving on community and caring for community, it's my hope that as community health workers and all involved in working with community, that you'll put on your own oxygen mask first and be a demonstration of what it means to be self-care. Because it's something that you promote all the time, right? And not necessarily taking the time to do it within ourselves. And so for this moment, in a way of just honoring you and just thanking you so much for all that you do, we just want to close out with a little grounding session brought to us by Ms. Lucretia Folks with Rooted in Love and Truth. And so this is just a closing treat for us this Friday, so that we remember to always keep our cups filled and to give from our overflow. And that's a part of that well-being. That's a part of that holistic living. And so I'm going to turn this moment over to Lucretia, and I hope that you enjoy this brief break, and we'll be back as we
Hello. Hello, everyone. I am grateful to be here with you all today. It is so important that we know how to regulate ourselves just with our breathing. And when I started doing breath work, it was such an experience for me that was transformational. And today I was in a seminar, and I learned, like, when you think about the brain, You think about the brainstem, you think about your lymphatic system, your cerebral cortex where you do all your thinking, and then your frontal lobe that pulls it all together. But when you are in that moment of frustration and anger, all of that goes away. And the only thing that is left is this emotional piece that to deal with. So just trying to bring that emotional piece down, because even listening to the presentation tonight, I'm like, I was one of those people that couldn't afford a medication for diabetes. You expect me to pay $250 a month for a medicine that you are not covering with my health care. So it brought my emotions back up. So we are going to take some grounding breaths, and we are just going to feel our way through this moment. So I just want you to close your eyes if you feel comfortable. If not, just lower your gaze. And we're going to do a few just deep inhales. Inhale with your nose. Make sure your stomach comes out a little so you are using your whole diaphragm, and release. Take a deep inhale again. Hold it. Think about all the good memories that you have from this experience and let it go. Knowing you can change the atmosphere and the world that we live in, taking a deep breath and release it. And now I want you to rock from side to side, right, left, right, left, right, left, right, left. Last time, left, and just stop in the middle. See how your body is feeling. And we're going to take a deep breath in. And this time, let it out with some sound. Let those emotions go. Take another deep breath in and let it out with some sound. And we're going to rock again to the right, to the left, to the right, to the left, to the right, to the left, to the right, to the left. One more time. Right, left, and stop. Take an assessment of how you feel in this moment. Everything that you have learned today, the knowledge that you get to share back with your communities, wherever you may live, if you're here in South Florida or even New York, we have work to do. And you have everything in your power to do it. Everything in your power to do it. Just know that it is amazing. You are amazing. And we are going to breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. And breathe in and breathe out. And we're going to honor those that honor us and honor those that honor us. Honor those that honor us. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. And as you slowly think about your day and everything that you have learned, we are going to come together and make a change. You have everything that you need for this moment, for this time in your life. Take a deep breath in and let it out with a grunt. Take another deep breath in and put a smile on your face, knowing that you are amazing and capable and ready, and let out the breath. And just think about how you are feeling in this moment, what you're feeling in this moment. May you leave with peace and understanding that the change can start with you. You are amazing people. And wiggle your toes, wiggle your hips, wiggle your fingers, and slowly come up to your neck and think about your throat. And we're just gonna imagine a bright blue color in this area real quick. May you have the voice to say what you need to say. Continue to be truthful on who you are and what you believe. And may your voice be louder than your enemies. And we're gonna come up to our eyes and slowly open them and return to our rooms where we are right now. And just do, while your eyes are open, just do one more breath in and one more breath out. And just put your hands up to the screen real quick. And everybody, may we have good energy for the rest of the night, for the weekend, and for the rest of this month, as we honor those who have built this country and made a difference in the world. May you be peaceful. Thank you, everybody.
Thank you so much. That was amazing, Lucretia. And your website is Rooted in Love and Truth.
Yes, it is.
Yes, visit her. I know that each Monday at 7:30,
Yep.
you offer breathwork sessions, so you are always able to connect with her. I thank you all so much. Carmen and Amelia, I thank you so much for being here, for sharing yourselves, just for all that you give. Thank you. Thank you so much for being here. Lucretia, I'm so grateful for you. Thank you for being here. And I just want to make sure that I remind everybody that's with us, thank you so much for being with us throughout this entire summit. Please come back and join us tomorrow, Saturday. It's Friday, y'all. That was like the best happy hour ever, right? And so feel free to come back. Please join us tomorrow at 1 as we learn about opportunities to get involved and expand and grow these initiatives here in Miami. Thank you so much. Have a wonderful night. Be well.
Thank you.
Thank you.